Hello everyone, my name is Dr. Thomas Hughes. I am a psychiatrist in Southern California. The topic for today is, if TMS is so effective, why have you not heard about it yet? What if I told you that 70 to 80% of depressed patients experience a notable improvement in depressive symptoms after TMS? And what if I told you that 50 to 60% experience no depressive symptoms at all after completing treatment? With numbers like that, why is it that people can name Lexapro or Prozac, which are antidepressants, faster than they can name different types of TMS devices? The answer is, it's our fault. Psychiatry, therapists, or any provider that manages mental health, it's our fault. And I'll tell you why. The number one reason you have not heard about TMS is due to a lack of experience with TMS in the outpatient setting. Most psychiatrists have been tested on information about TMS, so we know what it is, but many have never actually performed the procedure. And there are many reasons for that, such as the financial burden of having it in your private practice, or they might not have gotten that much exposure while they were in training, learning how to be a psychiatrist. For therapists and psychologists, they might have even less experience with TMS because I don't think it's a part of their formal training at all. And honestly, a medication consult can be tricky for them because knowing who to refer to or how to refer can be difficult. So if a medication consult is tough for a therapist, imagine how it would be referring for TMS. The number two reason is medication management training. Speaking as a psychiatrist myself, I know how we're usually taught. Instead of saying, hey, maybe you should try this procedure, you will most likely hear, hey, maybe you should try this other medication. And all of a sudden you're on your fourth, your fifth, or your sixth different medication trying to treat the depression. This isn't done with ill intentions. We're really good at picking other medication options. It's just what we know. The third reason is insurance and financial barriers. TMS can be somewhat expensive. It might not be covered by some insurances. Some providers might not bring it up if they know it's not financially feasible. Now, while that may be true, I still say bringing it up is the best option. The number four reason, this is most likely going to sound conspiratorial, but I do think there is some hesitancy with referring for TMS because there is always the potential for losing patients to a TMS provider, especially if that TMS provider also prescribes medications. I think that is much less of a problem than the previous three reasons, but I do think there is a small percentage that might hesitate to bring it up to their patients because it would be bad for business. If you are a provider that has that concern, you can always look up places that only do TMS, not medication management. At the end of the day, folks, if you didn't know TMS existed, now you do. If you want more information about it, either for yourself or for a loved one, look down in the description or subscribe to this channel for more. And if you're a provider, don't let your depressed patients be the ones to ask you about TMS. After you get to medication 3, 4, 5, and 6, you be the one to bring it up. They can be the ones to take the next steps and do some Google searches or ask friends and family members about it if you're not all that familiar with the procedure yourself.